Hi, my name is Amber Lynn, and I'm a juror on the Olivia Raines versus Ashford Hospital court case. It's in the matter of how Olivia's personal information was used. I've looked at both sides of the case, and in doing so, and also in my own research, I'd like to explain to you what I found, as well as what my decision is today. The situation is tricky. Olivia is a patient and an employee at Ashford Hospital. Um, the defendant claims that Olivia gave the hospital permission to access her PHI, both as an employee and a patient. Be that as it may, HIPAA law is in place, though, to stipulate when and how the information is going to be used. The plaintiff's personal information, such as her social security number, her address, her health records, her date of birth, and so on, was given out to all the employees at Ashford. In my research on hhs.org, I found that HIPAA law, in fact, covers a wide array of reasons a healthcare provider can with or without consent, use a patient's PHI, such as the healthcare provider can send PHI to anybody that's directly related to the care of the patient. That is, if the information is needed, specifically in that situation. However, the minimum necessary rule still applies to the hospital, and we'll go over what the minimum necessary rule is a little bit later. The four major points that stood out to me are, number one, all of the information released was not minimum necessary. In fact, it was all of her information. So from my research, minimum necessary means only the pertinent information that could help better her situation should be given out. Nothing more. Number two, the janitor and many others on the email list, as Olivia mentioned, were not directly related to her case. The entire staff at Ashford did not need to know all of that information about Olivia, and they didn't need that to complete their jobs, their daily jobs at the hospital, unless they were the physicians themselves, or maybe somebody with billing or administration, but not the janitor, as I mentioned. So, Basilios from our text suggests de-identifying Olivia's information in this case would have been much better served for the situation. Number three, yes, the defendant and also Davis and Silver from further research state Olivia consented to her employer that her employer could access her PHI as a condition of her hiring. Her employer, though, is not every person who works at the hospital. Number four, both the defendant and the plaintiff mentioned computer technologies and systems that are in place to protect patient information, such as this, from being accessed. So with all that protection that they have, just to email it out to everybody kind of defeats the purpose. They need to really rethink that. Olivia's supervisor, she could have accessed the information if she needed it, but she didn't need the information, and she didn't even request it, but it was sent to her. It was not necessary for her job, and she was not directly related to the surgery at all. For these reasons, I do side with the plaintiff, that her PHI, especially in the extent that it was, should not have been so flippantly released. I feel this error was not only completely unprofessional, but I also feel sorry for Olivia because she now works at a place where everyone knows way too much information about her, which obviously makes her feel uncomfortable. She doesn't have a sense of privacy anymore. From an ethical and personal standpoint, Olivia now has to worry about things like theft, the public's opinion about her, meaning her coworkers, unlawful workplace discrimination, since they all know how old she is, what part of town she lives in, what her race is, any medical conditions she might have. and she just feels violated by her coworkers now. She never thought that they would give this information out to everybody. So this incident, in my opinion, and according to HIPAA, um, and all the acts that we looked at, it should never have happened. And Ashford Hospital needs to take steps to prevent this from happening in the future.